thing is that there is a larger body biofield that science has not recognized because of the instrumentation that we use. It used to be thought that the EKG and the EEG were witchcraft, that they were not very real either. But now actually they're part of the human armamentarium, medical armamentarium. Some of these other devices will also be tested, will be found to have some validity and some value in the use in medicine. We've done testing with acupuncture systems. I mentioned that during my preamble. And we found that every single time that the body's fields are balanced by it. In terms of cancer itself, what you described as a process that you went through to help you with your cancer is a very, very common story. That the stress of the surgery and then the clot itself, but I suspect more of the stress of the surgery itself, can significantly, even though it removes the tumor, can significantly increase the stress level of the body, and blood tests can go out of whack for a while. The magnetic field system that we're talking about here is not a static magnet.
Okay, that's what I didn't
understand. Not, and it's not power line. We actually specifically build in a frequency that blocks out the effect of power line. That's 23 cycles. So the QRS is actually used to help people to build their immune system, to rebalance tissues, to help tissues to heal. And if you use magnetic fields over a longer period of time, you can't use it once or twice for this kind of circumstance. You're really talking about, again, a lifetime of use where you keep the body shipshape. And if you do that, then there's less likelihood of a recurrence. I was thinking as you were talking about clot, if you were using the QRS before you had your surgery, right after the postoperative period, you probably would not have had a clot. Some of the research in Eastern Europe has actually shown, they found this. It was a common observation that people who had magnetic field therapies around the time that they had surgery tended to have fewer clots. And
I only had one treatment before my surgery.
One treatment won't help you stop clotting.
And then I had several after my boyfriend snuck in the apparatus in the hospital, and I might have used it for about 4 days. And
yeah, that's not enough. The QRS is a very gentle system, and it will help you with clotting, but it can take several weeks for that to get to a point where the clotting system is now stable. It's like Coumadin.
Well, what I'm afraid of is it increasing my cancer.
I don't think you have to be concerned about that. But you know what? Given your concern, I think we need to do a one-on-one consultation. And rather than taking up all the time of everybody else on the line here today,
how do I reach you?
We gave you a phone number.
It's a toll-free number, and you can call me, and we'll set up an appointment for you and Dr. Pawlik. Okay, thank you. You're welcome.
Thank you. We'll chat again about this, and I'm sure that we'll hopefully satisfy some of your concerns. Any other questions?
Dr. Pawlik.
Yeah.
This is Donna Gans in Chicago.
Hello, Donna.
And I'm one of your greatest fans.
Thank you.
And I just wanted to tell you.
I'm one of your greatest fans.
Well, thank you so much. I just wanted to address the woman who was concerned about the cost of the mat. I've heard it said that the most expensive treatment or modality or medication or whatever you tried is the one that hasn't worked for you. And I just want to tell everyone that the QRS has worked for me, and it does exactly what it says it will do. If you give it time, it'll work. But the reason I wanted to ask you a question, could you speak a little bit about fibromyalgia?
In terms of the QRS, obviously we don't know entirely what fibromyalgia is.
That's going to be $3,000 as well.
Hello, whoever's talking in the background, please. Let me give you some advice in terms of the phones. If you want to have a conversation or turn music on or have a barking dog or whatever, press *6* on your own phone, and that will mute you out so that you can have background conversations that nobody else has to be disturbed or distracted by.
I did *6. Can you still hear me?
*6*. If I'm having a conversation with you, then you don't want to do *6*. While we're conversing. Okay, Donna.
Yes.
Fibromyalgia. Obviously, we don't have a complete understanding of what fibromyalgia is. one of the features of fibromyalgia is that people do have problems with sleep. There are significant EEG changes in people who have fibromyalgia. There are muscle lesions. There are enhanced trigger points in people who have fibromyalgia. The use of their muscles sometimes makes them better, sometimes makes them worse. There's often a lot of discomfort and a lot of pain with fibromyalgia. It often goes along with chronic fatigue in addition. And may be associated with anxiety, may be associated with depression. Static magnetic mattress pads have been found to significantly improve the pain and discomfort of fibromyalgia. From people who have had experience with both of them, what I'm hearing is that the pulse magnetic field, the QRS, helps faster and it helps better. Again, you can't do one or two treatments and expect miracles. It probably is a good point. Probably is a good time at this point to talk about perhaps what I consider the 4 levels of therapy, the 4 levels of treatment. One is the energetic level. Second is the physiologic level. The third is the pathophysiologic level. And the fourth is the pathologic level. I tell people all the time, magnetic fields do not create the Lazarus effect. They will not resurrect dead tissue. They will not resurrect, somebody who's dead or a dead organ. They will help tissue to recover that is able to recover. It will help tissue around dead tissue that is struggling to survive to recover, but they will not recover dead tissue.